Dr. Karina Lopez, and I'm here with Vitalist Healing Traditions, and I have the honor to see and be able to speak to some of my most wonderful people. And here is Shirley and her love, Daniel. And so I am going to essentially be first congratulating you guys because you came through so much. And we're here to talk about the journey that you've been on with your daughter. And I just want to say that it's been such an honor to work with you guys. And I'm really in such joy that we're able to talk about what's going on and how everything's progressed. So Shirley, what brought you to see us?
Weirdly enough, we've known of each other and we've met just about 10 years ago at a conference. And you've always been in my ear of somebody whenever like any friends of mine have had issues, I would just refer them to you. Like I will just say that she could take care of you. Dr. Karina will be good with whatever you're dealing with. And then fast forward to now when I had my own daughter and she was going through her medical issues, one of my friends who had seen you reached out to me and was like, why haven't you seen Karina yet? You introduced us to everybody, and why haven't you seen her yourself? So when it came down to one of the issues was potentially my daughter dealing with chemotherapy, and we were not of that school of thought that she needed the chemotherapy to.
So what happened? What was exactly going
on? So our daughter was diagnosed early on with infantile myofibromatosis, and is the really sporadic tumor within her right arm, focused on her ulna, and there was the opportunity to remove the tumor while it was still small enough not to impose any damage, but it was not removed, so it grew to the point that it pretty much destroyed that area. When we went for our second opinion, they were of the school of thought that it would make more sense to have her undergo chemotherapy to resolve the growing tumor and hopefully just figure out what we would do after the tumor was no longer an issue.
Some other steps in that journey that got us to that point. Mm-hmm. First, we were, her first care was with Johns Hopkins Hospital in Baltimore City. And the leading opinion there was to amputate the arm. And this was when they knew that what the prognosis was, the infantile myofibromatosis, which is a form of a benign tumor. It is not known to be cancerous in terms of, metastasizing or anything like that. Over time, it is supposed to, over a great many years, it'll either sit or resolve itself. So the recommendation of amputation was never something that should have been put forward. From there, we went to Children's Hospital of Philadelphia. It was there that they were suggesting chemotherapy and other forms of tumor reduction. And they also were of the school of thought that the damage that had been incurred to the elbow joint over the course of the tumor growing and the arm growing around the tumor would be to permanently fuse the joint. And thus another, while not as severe as amputation, another irreversible procedure. So from there, I think it was when Children's Hospital of Philadelphia wanted to try to put a port valve in her heart for chemotherapy that we, and Shirley at that time, had a friend who had unfortunately passed due to complications due to their own port valve that was not properly maintained. So both of us could not accept that as that this has to be the only choice. So we then consulted with Boston Children's Hospital, which is where they are the surgeons there currently looking at the bones for her arm. And then we contacted Karina as, what can we do about this tumor? What would you recommend? And that is when we started our, seeing Dr. Karina.
And that's when we gave you an alternative.
Yes.
And you really did something miraculous. Just really going towards alternative medicine and bravely doing what so many parents would be afraid to do. I mean, I can only imagine the other parents with a similar condition in their children who have amputated their children. And how old is the baby?
Right now, Margot is 2.5. She
So
still has her arm. She has, she does not have full range, normal range of motion in the elbow. We're hoping that over the next few months, with continued treatments as recommended by you, Dr. Karina, as well as any kind of potential corrective surgery to the bones with the pediatric surgeons from Boston Children's Hospital, that we can restore, either even close to 80% or full mobility to the elbow. But you're absolutely right. Had we been a different couple or from a different socioeconomic background or educated background, or even just different circumstances, we might have taken that amputation. Right now, Margot would only have one arm. She would only have one hand.
And not only that, what happened to the size of the tumor throughout the course of our work together?
So when we were prior to the treatments that you had suggested, the tumor more or less stayed inside. There was no noticeable decrease in size or anything. We started the treatments, and over the course of 3 months from the treatments that we had started, from when we had originally taken the CAT scan in the MRI at Johns Hopkins, and then from there we did another follow-up. So it was 3 months after that MRI that we started the treatments through Dr. Karina, and then another 3-4 months after that was when we got the next MRI, because we were doing it every 6 months. And then on that next MRI, that was in December at Boston Children's Hospital, that was when we had gotten Dr. Peter Waters reported a 75% reduction from the size of the tumor.
So that's 75%. Let's just stop for a second. In 3 months, there was a 75% reduction in the tumor. And now you recently told me that she regained some movement in her hands.
Yes. This past March, she unfortunately broke her arm in the area that was the damaged arm, and
the phone's going to die. I'm going to try and avert that.
Thank you. So she broke her arm. It was a damaged arm, and once the cast came off 6 weeks later, we assumed that the arm would lose mass and strength, and honestly range of motion that she had gained, and the complete opposite actually happened. While she was in the cast, she was still taking her protocol that you provided, and she retained her arm's mass, so it was not a reduction in size versus the 2 arms. She actually increased her range of motion, and prior to the cast, she really had use of her thumb, her forefinger, and her middle finger, and then after the cast, she now has more flexibility on all 5.
This is amazing. So wait, am I getting this straight? So instead of an amputation, instead of an irreversible surgery, the tumor went down by 75%.
Yes.
And she was able to regain some mobility in all 5 fingers.
Yes.
And even after an injury that happens, she was able to maintain tone, flexibility, and no weakening. I mean, this is what real healing is. But I really have to tell you that you guys came together and you did something incredibly beautiful for this child. And it's, everyone imagines wonderful health. Everyone fantasizes about their child, doing it and overcoming whatever obstacles they have. But you achieved this. It wasn't a fantasy or a prayer. It was action. And you guys did really beautiful actions. And I'm so honored to have been collaborating with you and working with you. And really, it's just a collaboration. All that we did was a collaboration and a journey. And I just have to thank you guys for being so wonderful, because this is real healing. And
No,
so with that being said, yeah. And with that being said, I want to tell, would you give any advice to any other parents out there? What would you tell them who are also dealing with their children and something that seems really scary, really frightening? What would you say?
I would say the first thing, and sorry to cut you off. I would say the first thing is never accept what you feel is anything less than what your child should get. We have been the greatest fighters for our daughter's health, and we have to be. If we had just allowed other doctors' recommendation, esteemed doctors, Johns Hopkins Hospital, Children's Hospital Philadelphia, these are two of the highest, most esteemed hospitals in the United States, internationally renowned. And it was because we said, no, we can't accept that. We want our daughter to regain and maintain the health that she deserves. And we fought for that. We fought and went from specialist to specialist. And me being someone who, my father was a pharmacist, a doctor. I was raised believing in, homeopathy was nothing but snake oil and legends and, Western medicine all the way. And even for me, as someone who's gone through this journey and, been unwilling to accept the compromises that other doctors and specialists put down, saying, this is not possible. She will never gain this. This is what you have to do. This is the best course of action. I would say that's the first recommendation to any parent, that you are your child's last defense against the world. And if you at all feel like there could be hope and there could be the possibility of something different, pursue it, because if you don't, no one else will. And looking back over the journey that we've been through, the remarkable bounds that Marco has made, it's just, you have to fight, don't give up, and never settle for compromise. Just don't.
Thank you so much, guys. And you wanted to say something, Shirley?
I really do believe it really comes down to the energy and the people you have fighting for your child. A lot of the time, it really came down to like a lot of so much research and just like time on the back end on our side, just figuring out, okay, who do we want to be on our daughter's team, and just making sure that they have the same vision that we have. I feel like a lot of times, like when you're working in this space, like Daniel was saying, that cynicism, that really black and white thinking is so linear that it leaves room for very little else. And doing that research and seeing what other individuals and other folks in different countries have done, we're like, well, this is what we're advocating for is not outside the scope of reason. It might not be something that is readily thought to do, but what we're talking about is really, can we give our child another option? And if we can't give her another option, what does it look like? And actually taking the time to actually delve into what does that look like. It's like I've told you in passing, you are a rare individual, because the time to actually sit down and talk with parents, especially while they're going through a trying time of dealing with the unknown when it comes to their child, and actually having someone really listen to you and hear you and give you options beyond what's linear and really stretch their scope of thinking into what's actually possible. The daughter that we have right now would not be the daughter that we would have had we not done something different. which is reach out to you and just really advocate and lean into our own understanding to the fact that we had to become functional experts about what our daughter is dealing with. So when people tell us no, we will say, actually, the research says this.
And you know, I think that, yes, yeah. And you know, you went beyond the research. You went into what real healing is. And I will always thank you guys. And I'm so honored to be on our path, because it's become our path, right? Because it's not the doctor heals the patient. It's I help you with my recommendations. I send you my real warm, real care, real compassion, and whatever I can, using the most simple, effective healing means. So I think we came together, we made a goal, we're continuing our goal, and so far we've been doing beautiful. And I'm so thankful for you guys. And anyone who's listening to this, please visit us at vitalisthealingtraditions.com, and we're helpful and happy to help you on your journey. And thank you so much, guys.